Hi everyone, welcome to Medicine Note YouTube channel. In this video, we are going to see about pleural effusion. It is a collection of fluid in the pleural cavity. Generally, the pleural effusion is collection of fluid in the pleural cavity. It might be transidative fluid as well as exudate. It might be transidate as well as exudate. According to the fluid, it is divided into transidative pleural effusion as well as exudative pleural effusion. The transidative fluids these are the fluids comes when there is increased hydrostatic pressure. When there is increased hydrostatic pressure, these fluids comes out from the capillaries. The exudate are the cell leak fluid. When the fluid is leaked by the cell due to the infection or inflammation, any infection or any inflammation causes this exudative fluid. This transidative pleural effusion, there is no pleural involvement is seen, but in exudative pleural effusion, there is pleural involvement seen. Now we will see about the pleural effusion. It can be divided into unilateral as well as bilateral. Unilateral means only one lungs are affected. Bilateral, both lungs are affected. Unilateral examples are subpharyngeal abscess. In these conditions, there is unilateral pleural effusion. Pancreatitis, amoebic liver abscess. Bilateral are cardiac failure, pulmonary infarction and rheumatoid arthritis. Now we will see about the pathogenesis of this pleural effusion. When there is increased production of fluid by infection. As I have said already, in exudate the cell leaks fluid due to infection or inflammation. So that in infection, when there is increased production of fluid, and there is decreased absorption of pleura. When the pleura doesn't absorb the pleural fluid, it might cause pleural effusion. And increased hydrostatic pressure and oncotic pressure. And increased capillary permeability. When the capillary increases its permeability, there are more fluid accumulation inside the capillary. So it might cause pleural effusion. Not only transidate and exudate fluid alone accumulates in the pleural cavity, there might be a chance of blood can also accumulate. So bleeding into the pleural, which also causes pleural effusion. Bleeding into the pleural cavity might also cause pleural effusion. Now we will see the etiology. Etiology, the transidative and exudative. The transidative means when there is increased hydrostatic pressure, and the exudate is due to infection and inflammation. Without involvement of the pleura, transidate and exudate is with involvement of pleura. In transidate, congestive cardiac failure, constrictive pericarditis, nephrotic syndrome, cirrhosis of liver, hypoproteinemia. These are the conditions which comes under the transidative because of increased hydrostatic pressure, and this. Now you will see of the exudation due to infection or inflammation. So that tuberculosis due to infection, the tuberculosis, it is a most common cause for unilateral pleural effusion. This unilateral pleural effusion most commonly which we see is in tuberculosis. Pneumonia, there is inflammation is seen. Pulmonary infection, also inflammation is seen. Pancreatitis, which is inflammation is seen, as well as rheumatoid arthritis, inflammations of joints are seen. Now we will see the clinical features. This pleural effusion is slow as well as insidious. Pyrexia is seen. Pyrexia means increase in body temperature due to inflammation. The signs of inflammation are rubor, calor and dolor. So that the inflammation, there is increased body temperature. Dyspnea, difficulty in breathing. All respiratory condition, there is this clinical feature which is known as dyspnea, where there is difficulty in breathing. Now you will see the inspection. The chest is bilaterally symmetry. Both chests are symmetry even when there is pleural effusion in one lung, but when we see from outside, both the lungs are equally bilaterally symmetric. no difference between even when the lungs are unilaterally affected. The movement of chest is restricted on the side of effusion. When the left side gets pleural effusion, the lungs get pleural effusion. This left side movement gets restricted. Normal breathing movements are getting restricted. We can't see the normal breathing movement. Now we will see the palpitation. After first inspection, what we see, palpitation, we will touch and see. The trachea and mediastinum is shifted to the opposite side by the push. While we push, the trachea and mediastinum shifts to opposite side. Percussion, there is stony, dull note as well as diminished absent sound over an area. There is stony as well as dull note is seen. Investigation is chest X-ray and ultrasonography. Treatment is aspiration of pleural effusion. No more the treatment. We should aspirate the pleural fluid. We should not take more than 1 liter per day. The treatment is treatment of underlying cause. We should treat the underlying cause due to infection or any other inflammation. We should treat the specific cause. Thank you. Please to subscribe my YouTube channel. If you want any other video, please to like, share and subscribe my YouTube channel. If you have any doubt on it, please to comment it. If you want any other topic, please to suggest in the comment box. Thank you. Please to subscribe.